Hi everyone, today I am giving you information on the topic blindness. This one is the blindness part 10, in which I will explain you about the topic glaucoma and the diabetic retinopathy, that how they both will contribute to the blindness in India. So let's move to the glaucoma. As per the National Survey of the Blindness, in the 1999 and the 2001, the Government of India reported in the 2002 that glaucoma is responsible for the 5.8% of the blindness in the 50% of population as per the RAAB in the 2006 and 2007. The corresponding figure is 4.4%. Effective intervention for the prevention of the glaucoma resultant blindness is quite difficult. Failure of early detection of disease possesses a management problem towards the controlling glaucomatous blindness. Population-based screening of glaucoma is not recommended as a strategy in the developing countries. Okay, so glaucoma is basically a kind of disease in which pressure of the eye increases. Okay, and it affects the optic nerve. It results the cause of the blindness because the peripheral vision first of all starts decreasing. When the peripheral vision starts decreasing, then the central vision starts decreasing, and this process takes place in a very slow motion, so that patient will not be able to understand that what's going on. Okay, and the pressure of the eye increasing, which is very important to control it. So the failure of the detection of disease possesses a management problem. Okay, so it is very important to detect it at the early stages so that we can control it. Okay, and prevent the blindness in our country. Next one is population based screening of glaucoma is not recommended as a strategy in the developing countries. Okay, so it is very important to find out the glaucoma, which get done by the ophthalmologist and the optometrist. Case detection. Now how can we detect that the person have the glaucoma or not? How we select the case and how we detect the case of the glaucoma. Case detection by the tonometry and the fundus examination. Okay, in case of tonometry, we will find out that what is the pressure of the eye, which is done by the tonometer, non-contact tonometer, which is the NCT by AP. Okay, and the different machines are present there, so that we will detect the pressure of the eye and detect that the patient have the glaucoma or not. Next one is fundus examination. In case of fundus examination, cup disc ratio should be seen. Okay, if the cup disc ratio is 0.3 and 0.4, more than 0.3 and 0.4 will be abnormal, and it give the sign that the patient may have the glaucoma. Then the different tests are done. For example, discosity, RNFL, ONH. Discosity should be done for the patient. Perimetry will be done for the patient. So these are all are the options which can detect the glaucoma of the patient. Opportunistic screening at the eye care institution should be done at all persons above the age of 35 years. Okay, so this screening should be done. Basically, we will do the measure the pressure of the eye, as well as do the fundus examination in the persons who have the age above the 35 years, and those patients who have a diabetes mellitus, and those who have a family history of glaucoma. Okay, so glaucoma is a kind of diseases which passes on from the generation to generation. Okay, so some persons have the family history of glaucoma from behind to behind, then it will pass on from the generation to generation. We will take out the history of the patient, that anyone have the glaucoma in the family or not, and those persons who have diabetes will also take into consideration and basically check and basically detect if they have the glaucoma or not by taking their checkup those patients whose age is more than 35 years. Community based referral by multi-purpose workers of all persons with diminished of vision, rapid change in the glasses, colored halos, ocular pain, and the family history of glaucoma. Okay, will also take those persons who have diminished of vision, who have a blurring of vision, rapid change in the glasses. Okay, their glass power becomes changed rapidly. Those patients who have a glaucoma, colored halos should be seen. Ocular pain is the main symptom, and the family history of glaucoma. Okay, so all these things are taken into consideration while detecting the case of the glaucoma. Opportunistic screening at the eye camps in the patients above the age of 35 years. Okay, screening should be done at the eye care camps or eye checkup camps to those patients whose age is above 35 years. Next one is the diabetic retinopathy. Diabetic retinopathy is basically the damage of the retina which takes place due to the uncontrolled diabetes in the patient. If the diabetes will remain uncontrolled for a longer period of time, then it will cause the diabetic retinopathy. The damage of retina takes place due to a high or the uncontrolled diabetes. Diabetic retinopathy is emerging and an important cause of 4.7% cases of the blindness due to the posterior segment disorder in the 50% population. Okay, this contributes 4.7% of the total causes of the blindness. So it becomes very important for a diabetic patient to control the diabetes if a person have the diabetes, so that it will not affect the eyes, because diabetes is a systemic disease which affect the kidneys also, eyes, heart, etc. It will affect the different parts of the body. Okay, next one, to prevent the visual loss occurring from the diabetic retinopathy, a periodic follow-up is very important for timely intervention. Okay, 6 months follow-up, after 6 months, or follow-up in once in a year is very important for a diabetic patient to the ophthalmologist as well as the optometrist. Next one, recommendations. What are the recommendations? Awareness generation by the health workers. Health workers will generate the awareness in all the patients who have a kind of systemic illness, for example diabetes, hypertension, asthma, thyroid, any kind of heart diseases. So these people have to do the proper eye checkup to the ophthalmologist and well as the optometrist every year. Once in a year or after 6 months they will do the follow. Next one, all non-diabetics to be examined and referred to the eye surgeon by an ophthalmic assistant. Okay, awareness should be generated in those patients that they have to refer to the eye surgeon. Confirmation by the fundus fluorescein angiography, laser treatment and diabetic retinopathy at the tertiary level. When the diabetic retinopathy will reaches at the last stage, then different types of treatment should be done. Fundus fluorescein angiography. Angiography of an eye should be taken by giving an injection, injecting a dye inside the hand, and then it will pass on to the heart, then it will move to the eye. Okay, so that test, fundus fluorescein angiography, should be done. And the laser treatment, sometimes laser should be given. Green laser is done for the treatment of the diabetic retinopathy if it will reach to the advanced stages. The strategy must be to bring down the medical management of diabetic retinopathy at the secondary level. Okay, so as soon as early as the generation of the awareness should be there in the persons or the patients, according to that we will control the blindness which causes due to the diabetic retinopathy. Okay, this was the end. Thanks for your patience listening.